Welcome to the Athlete Recovery Den University, where I teach you how to do some stretching techniques on athletes. Our first technique is going to be the hip flexor quad stretch. So what you're going to do is have your patient grab one leg. You're going to lay back. You want their butt halfway off the table so you can get a good stretch. You're going to stabilize the leg that they're holding. Other leg is the one that we're going to stretch. You're going to use your leg to kick their knee back to get a stretch in the quad. And then you're going to also put some pressure on the top of the thigh to get that hip flexor. You want to check in with your athlete to make sure they're feeling okay. If it's too tight, back. You're going to hold it for 1 minute. Feet lay on their back. You can also have them come a little bit closer to you. So from here, we're going to start with the calf stretch. You're going to lift up their leg. Then you're going to use your opposite hand to grab their leg. Stretch the calf. You're going to pull the toes toward you. You want to hold that about 30 seconds. They should feel a stretch in here. Always check in with your patient. And then after you hold that for about a minute, we're going to go into the hamstring stretch. So you're going to grab their leg. You're going to use your hand or your forearm to stabilize the leg. Then you're going to stretch. Use your other hand to put on their thigh. And then you're going to stretch. You keep a micro bend in the knee so it can protect them. You're going to hold it for 30 seconds to 1 minute. Our next stretch that we're going to do, we're going to shake out the leg a little bit. That way the athlete is relaxed. We're going to work on their glutes. So, all we're going to do, bend the knee, bring their knee to their chest. Have their athlete put their hands to the side. To get a deeper stretch, you can put your body onto their shin, hold on to the table, and lean in. Okay, great. From here, you can also, you're going to do the same thing, kind of getting the groin adductor. You're going to bend the knee. Foot into your hip, and then push forward, holding about 30 seconds. In between stretches, feel free to shake out the leg. That way it keeps the athlete relaxed. Next stretch we're going to do is the adductor stretch. So instead of having the knee bent, we're going to keep it straight. And then use your right hand to stabilize the opposite leg. You can put their lower leg into your hip or thigh, depending on how tall you are. And then use your body to stretch them further. Again, we're holding the stretches for about 30 seconds to 1. The next series of stretches we're going to do is for the upper body, specifically the shoulder and arm. We're going to work on external rotation, internal rotation, and abduction. So the first one we're going to do is external rotation. When working on the shoulder, you want to shake out the shoulder and the arm like you did the leg. The athlete comes close to the edge of the table with you. Keep the leg, keep the arm relaxed, stretch it. You're in good hands. Now from here we're going to work on internal rotation. You want the arm, the shoulder at 90 degrees, and the elbow at 90 degrees. Get on one knee. Pick the arm furthest away from the athlete. Have their elbow rest in the crease of your elbow. And put your hand on their shoulder. From here, you put your other elbow on top of your hand, stabilize the shoulder, and then you use your hand to push their arm into internal rotation. You want to keep that shoulder and elbow at 90-90. Always double check with your patient to see if they feel okay. Hold this for 30 to 90 seconds. Next stretch, the bicep chest stretch. You have the arm, shoulder still at 90, elbow straight. And you're gonna let it hang off the side of the table. From here, with your hand closest to the body to stabilize the shoulder. Then you're gonna push their arm back toward the table. On this one, you really want to check in with the athlete to make sure that they're feeling okay. To get a deeper stretch, push their fingers into extension. And that also gets the forearm a little bit. All right. For the next stretch, from here, we're going to work on shoulder external rotation. So here, we're going to shake out the arm, working on external rotation of the shoulder. You're going to have your leg that's closest to the athlete and in front. You're going to basically be stagger stance. You're going to rest their arm on your leg. And then you have their shoulder at 90, so 90-90 again. From here, just let the arm fall, see how much external rotation they have naturally. Then you're going to put your hand closest to her shoulder, on her shoulder to stabilize. Then you're going to go back using the other. Try to have a good grip on their wrist. And then always check in with your athlete. Make sure that it's not too much. And again, hold it for 30 seconds to about a minute. Last couple stretches we're gonna end with is for the back. So we're gonna have the patient lay on their back and bend their leg where the knee and ankle line up. Here you're gonna stabilize the shoulder. Whenever you're on this side, you're stretching the opposite side. You're gonna put your hand, you're gonna crease with their knee. And then you're going to rotate their lower body. This one is going to be like a pretzel twist. You might feel it in their back, and you might feel it in their butt. You're holding the shoulder, keep the body, upper body still. And this one we can do at different angles. So you can bring the knee up towards the opposite shoulder a little bit. And really push down, get that twist in there. You can also do it with their legs straight. Bring it across the body. Put their leg kind of in your body. And push. Stabilizing the other leg with your hand. Take it out. And then from here, we're going to bend both legs. You're going to bring their knees to their chest, stretching the low back. So like hands are going to be to their side. You're holding at the feet and the knees with some stability, pushing in to release to the low back.